I'm Susan Poole, and I'm going to give a short demonstration on how to effectively use the premium red light therapy pad for equine use. The pad will come with a lithium-ion rechargeable battery, which lasts for about 3 3/4 hours continuous use. But lithium-ion batteries need to be recharged after every couple of hours, as they don't like going to ground. It's not good for their longevity. To charge them, you simply lift up the flap and the charger socket goes in there. Now to switch the pad on, just move the switch over and the LEDs will glow. Now you've got your red LEDs and your infrared LEDs. The infrared LEDs aren't visible to the naked eye, but they can be seen to glow lightly if you look at it through a digital camera lens. The pad also comes with tabs, which for difficult places, you just remove the tabs and you get extra flexibility in the pad. Otherwise, just leave the tabs on. So first of all, for leg use, and the pad comes with 2 short straps and a long strap. So for attachment for the legs, simply Velcro the straps on. Have it so that the battery is on the outside of the pad, so that you've got less risk of the horse damaging the battery should it come over. So simply for tendons, place the pad like so. If the pad is wrapped around the limb, 15 to 20 minutes will give a good therapeutic session. If the pad is laid open, 20 to 30 minutes will give a good therapeutic session. The body will only absorb what it needs in any one session and just discard the rest. And you certainly won't be doing any harm if you leave the pad on for longer. Now, for shin soreness, if the shins are particularly tender, we recommend you wrap a light white bandage or serum cloth over the shin. And the pad will simply come around from the front. Incidentally, for wounds, you can do the same. Cover the wound with a light white bandage so the wavelengths won't be interrupted, affected going through that light white cloth. Now, for any issues in the hoof, laminitic issues, take the tabs off for extra flexibility, and the lowest couple of rows of lights, as long as they are on or below the coronet band. In the coronet band, you've got acupuncture points called ting points, and they are either the start or the finish of an acupuncture meridian. And by stimulating those points, you're helping to draw circulation into the hoof. So keeping the battery to the outside, you just attach like so, so that the lowest row or 2 of lights is on or below the coronet band. Now for knees, simply up there and lightly, so that should the horse want to bend its knee, it's not going to be restricting. For hop placement, you might like to use the longer strap as well. And we recommend for hops that you put a float boot or a tendon boot or the like on the lower part of the leg, so that should the horse kick around, it's not going to slip down the leg and be at risk of being trodden on. And maybe using the larger strap, lightly keep the pad in place. That's the recommended position for any hop placement. Now this is what we call a stifle boot, stifle ice boot. Roma make them, other companies might make them. So in them, you can conveniently place the therapy wrap. So I'll put the tabs back on the pad to keep it stiffer now that we don't need that extra flexibility. And you simply tuck it in place. Now, it will also come around the back to work with the hamstrings. I recommend using the bullnose clips. You get 2 of them with the pad to clip it into place to help hold it secure. Now for other positions, for example, the pole, tuck them away. Simply place the pad so that it is sitting where it needs to be. Tighten up the halter to help keep it in place. Again, you can use your straps. The straps conveniently joined together if need be to help hold the pad in place. Now for the top line of the horse, I'll just take this off. We can use a cotton rug and conveniently, using the bullnose clips, effectively clip the pad in place. So wherever the pad needs to go, if it's a shoulder issue, again using the clips, you can clip it in wherever it's required, whether it's your wither, the top line, down onto the hip, and it will stay there nice and firmly. If you've got any questions, don't hesitate to email us on info@redlighttherapykits.com. There are also pictures on the website as to the different placements for horses. Thank you.